What can we say about the efficacy of these lockdowns? I noticed Peru had one of the most severe lockdowns, and I think they're number one in the world for per capita mortality. There were some other countries that did very little in that way, who have significantly less mortality. So how would you analyze how the role that the lockdowns have played, and have they shown to be able to really reduce deaths in the disease, or is this just something that they're pushing the infections out over a longer period of time?
Yeah, so back in March, it made sense to flatten the curve because we don't want to overburden the hospitals. And I think that was a success in most parts of the world, except I think Spain and Northern Italy. But if you do a lockdown beyond that, you're sort of pushing the cases in the future. And instead of sort of doing a lockdown that's general for the whole population, that doesn't make sense from a public health perspective. So instead, what Dr. Bhattacharya said is that we have an enormous difference in risk by age. So everybody can get infected. And but the risk for mortality is more than 1,000-fold different risk for the oldest people versus the younger. So for the older people, this is worse than the annual flu, but for children, this is much milder than the annual flu. Normally, we have a few hundred deaths of children dying from the flu every year, and that's much less here. And even in a country like Sweden, where they never closed the schools, all daycare and schools in Sweden was open from age 1 to 15 throughout the height of the pandemic there. And among the 1.8 million children in Sweden, there were exactly 0 deaths from COVID-19. So this is not a dangerous thing for children nor for younger adults. So from a public health perspective, what makes sense is we have to do as well as we can, and a lot better than what was done previously in many parts of the world, to protect the elderly, both at nursing homes, but also people who live at home or people who live in multi-generational families. So we have to do as much as we can to protect those high-risk groups. But children and young adults, they should be able to live lives normally, more or less. They should wash their hands and those kind of things, but there's no public health reasons to close schools. And I think these sort of general lockdowns of closing schools or closing restaurants or closing beaches or whatever, that actually have a detrimental effect on public health.